Hello, I'm Dr. Michael Brown with Meritas Health and North Kansas City Hospital, and I'm here today to talk to you about how to use an albuterol inhaler appropriately. Why is it important to use your albuterol inhaler appropriately? Well, most people, when they use it incorrectly, get less than 10% of the medication with each dose. At best, when you use the inhaler appropriately, you're getting only about 50% of the medication in your lungs. So it's very important that you use it as directed. The most common prescription for albuterol typically comes in two brands, either ProAir or Ventolin. So your inhaler will probably say one of those two brands. But for the sake of this video, I'll refer to it as albuterol. Typically, it's prescribed to do 2 puffs of your inhaler each time you have an episode of chest tightness or wheezing. It's important that you review with your primary care provider how to use it and when to use your albuterol inhaler appropriately if you have any questions regarding it. Your albuterol inhaler works as what is called a beta agonist. This takes advantage of what we call the fight or flight response. For instance, when a bear jumps out at you in the woods. Well, it's very important for your lungs to open up in that kind of situation and give you as much air as possible so you can run away from the bear. That's what albuterol does. It takes advantage of that. And that's why after using this inhaler, you might feel things like your heart racing or fluttering. That can be very normal after using your albuterol inhaler. And if you have any concerns with the side effects of albuterol, please be sure again to bring them up with your primary care provider. If it's the first time that you've ever used your inhaler, you actually need to prime your inhaler. This means pushing it down until you get a nice even spray. So you'll push it down a few times until you get a nice, steady, even spray. You need to prime your inhaler the first time you've ever used it, or if you haven't used it in more than 2 weeks, or after you may drop the inhaler. It's very important to do that to make sure you get a nice, steady, solid, even spray each time you use it. I'm now going to review with you the appropriate steps for using your inhaler. The first thing you'll want to do is take your cap off and make sure it's clean and clean the mouthpiece off. You'll then want to shake it 10 to 15 times. Without the inhaler, you'll want to take a big deep breath in and a big deep breath out all the way. You'll then take the inhaler and you'll put it in between your lips and above your tongue. Before you press down on the inhaler, you'll actually want to begin breathing in slowly. A lot of people will push it down and then begin breathing in, but that's not appropriate. What you should do first is start breathing in and then push down your inhaler so that you get the maximum amount of the medication. Now this is a training inhaler, and so it actually makes a noise when I start breathing in. Your inhaler will not do that, but this is so that you get an idea of what I'm doing on this video. So when you hear that noise, you'll know I've been breathing in. After you begin to breathe in slowly, you'll push the inhaler and you'll take a big deep breath in. Now this is the most important part. Again, as I said earlier, you don't want to breathe in quickly and then immediately exhale the medication. Remember, it only gets to here, and we want to get it down to here. So what you're going to do is after you breathe in all the way, you'll want to hold your breath as much as you possibly can. Usually about 10 seconds is what we're trying to go for here. But as long as you're able to comfortably hold your breath in, the more medication you're going to get in. After you've done about 10 seconds of holding your breath in, you'll want to breathe out slowly. Again, you don't want to breathe out too fast. So I'm going to demonstrate these steps for you again. Remember, taking the cap off, making sure it's clean, shaking the inhaler, taking a deep breath in, out. Now doing this twice is typically a full dose. So I would repeat those steps one more time to get my second puff of that dose. Some points to remember: do everything slowly. Breathe the medication in slowly, breathe the medication out slowly. Also, I recommend that after you use your inhaler, you always rinse out your mouth and brush your teeth. If the medication is not working for you appropriately, or you're not getting the response that you used to get from your inhaler, please be sure to follow up with your primary care provider so that they can talk with you about what needs to happen next. Thank you again for letting me teach you how to use an albuterol inhaler appropriately. Once again, I'm Dr. Michael Brown with Meritas Health and North Kansas City Hospital.